The Pathway of the Radial Nerve and Risks for Injury by Michaela Van Handel, Alex Wagner, J.P. Swanson, and Caitlin Elvers. The overview of the radial nerve. To start, we will provide a brief overview. The radial nerve is a posterior branch off of the brachial plexus. At the axilla, it runs from the radial groove of the humerus and innervates the triceps brachialis, anconeus, and brachioradialis. The overview of the radial nerve. The radial nerve passes through the cubital fossa and then flows into the forearm. It innervates at the supinator extensor carpi radialis. After passing through the cubital fossa, the radial nerve divides into a superficial and deep branch. The deep branch innervates the extensor muscles, and the superficial branch innervates the muscles and skin of first through third and half of the fourth digit.
The radial nerve is one of the major peripheral nerves of the upper limb. It's derived from the brachial plexus, and it's a continuation of the posterior cord. It arises in the axilla and continues posterior to the brachial artery. It passes with the profunda brachii artery into the posterior compartment of the arm at the triangular interval. It supplies the medial and long heads of the triceps muscle. Then it begins a sensory branch. So it starts at the posterior cutaneous nerve, which supplies the skin of the posterior surface of the upper arm and then curves around posteriorly. It descends down the arm, traveling down the radial groove. It moves inferiorly and wraps around the humerus in a lateral direction. It supplies the lateral head of the triceps brachii, and it's accompanied by the deep branch of the radial artery called the profunda brachii. It breaks into two more sensory branches, the inferior lateral cutaneous nerve and the posterior cutaneous nerve of the forearm. So the inferior lateral cutaneous nerve perforates the lateral head of the triceps. It also innervates the lateral part of the forearm. The posterior cutaneous nerve perforates the lateral head of the triceps and continues posteriorly to innervate the skin of the middle posterior forearm. Then it goes through the lateral intermuscular septum and enters the anterior compartment. It settles between the brachialis and the brachioradialis. It moves anteriorly over the lateral epicondyle of the humerus through the cubital fossa. So then finally it divides into two branches at the proximal end of the forearm, the deep branch and the superficial branch. So the deep branch is for motor function, and it passes in between the two heads of the supinator. It turns into the posterior interosus nerve. It innervates muscles of the posterior compartment of the forearm. And then we have the superficial branch that's more sensory oriented, and that descends down the anterior lateral part of the forearm. It's located deep to the brachioradialis. It travels with the radial artery, and then it curves around the lateral aspect of the radius and continues dorsally. Finally, at the hand, it passes over the anatomical snuff box, and it innervates the dorsal lateral surface of the lateral 3.5 digits.
Now we're going to talk about injury to the radial nerve. The location of the radial nerve injury can be categorized in 4 ways. It can be at the axilla, the radial groove of the humerus, the superficial forearm, or the deep forearm. Injury to the radial nerve can cause impaired motor and sensory function of the upper extremity. In order to understand how injury to the radial nerve can impact function, we need to take a deeper look at the motor and sensory functions of the radial nerve. In order to help with muscle movement, the radial nerve innervates the muscles of the posterior compartment of the upper arm and forearm. This is done, for example, it activates the triceps brachii at the elbow joint to help with extension. It also innervates the extensor muscles of the forearm to help with wrist and finger extension and supination. The radial nerve also helps us take in sensory information because it innervates most of the skin on the lateral side of the upper arm, posterior side of the forearm, dorsal to lateral side of the palm, and lateral 3.5 digits. This chart provides a breakdown of the mechanisms that can cause injury to the radial nerve, along with a list of motor and sensory functions that could be impaired based on the location and injury of the radial nerve.
So, wrist drop is a symptom of radial nerve injury. Wrist drop occurs when there is difficulty or inability in extending the hand or raising the hand using the wrist, and looks like the picture in the bottom right-hand corner that is circled. The hand or wrist may also be weak and the fingers could be affected. Widespread numbness throughout the wrist, hand, and fingers is also not uncommon. Other symptoms include wrist pain, tenderness, and swelling. Another way the radial nerve can be injured is through the improper use or improper fitting of crutches. If most of an individual's weight is placed on the axilla pad of the crutch instead of on the hand pad, it can put pressure on the radial nerve in the upper arm. This pressure can then cause radial nerve injury.
Ow, these crutches are way too tall. They're hurting my armpits. I can't feel my dorsolateral 3.5 digits.
Sensory issues in the cutaneous skin that the radial nerve innervates can also signal radial nerve injury. Any tingling or loss of sensation or loss of function in the areas associated with the radial nerve can be clues that that nerve has been injured. So any sensory symptoms in the lateral arm, posterior forearm, or the dorsal surface of the lateral 3.5 digits would signal a radial nerve issue.
Thank you.